with me, Ronak Kutecha. And now in the studios, we have Dr. Babita Shetty. She's a specialist obstetrics and gynecology at Medcare Royal Specialty Hospital, Qusais. Hi, doctor. How are you doing?
Hi, good afternoon.
Good afternoon. So, doctor, tell us what all are your specialties?
I'm practicing OB-GYN specialist from the last 18 years here in Dubai. And I do treat a lot of patients with high-risk pregnancies. And I also do a lot of advanced endoscopic procedures, treating for endometriosis, fibroids, and also other ovarian cysts and other endoscopic procedures like daycare procedures like hysteroscopy for polyps and irregular menstruation.
All right. So, currently in your line of practice, what are the kind of issues that you generally come across? What's most common?
Well, we do have a lot of patients, the spectrum from young girls, teenagers, adolescent, and also young girls who are trying to conceive, who come with irregular periods and weight gain and fertility issues. So then we try to investigate them. So it could be endometriosis or polycystic ovaries. And we also have patients who are with high-risk pregnancies with other endocrine disorders complicating it, like diabetes mellitus, hypothyroidism, and also some bad obstetric histories and high-risk pregnancies with repeat cesareans, 2 or 3 cesareans, and other placental complications.
Yeah, we had a doctor I think 2 days back. We were talking about repeat cesareans and natural birth and stuff like
Yes.
that. And clearly, extremely, sensitive topics, of course, but
True.
need to be talked about. Awareness has to be spread. Now, one thing that we often come across is PCOS and PCOD, and then there are fibroids, and then there are endometriosis.
Yes.
These multiple problems, how different are they from each other, and can someone have all of these?
Possible, yes, we do. See, it also depends upon the age group, because the whole triggering factor for the fibroids or the endometriosis is the estrogen hormone. So we do tend to see all these in the reproductive age group. So a lady could be having heavy periods and painful periods, and when she comes just for an ultrasound, incidentally we could diagnose that she has fibroids. And the fibroids can vary in size, and they also can vary in the positions. It could be inside the uterus, outside the uterus. So depending upon that, we reassure the patient, and if it is really huge, and assessing what their concern is. There could be patients who say, I'm trying to conceive, but I'm not able to conceive.
Right.
So we try, then if there's a fibroid within the uterus protruding into the cavity, then they will need removal. And there can also be patients who say that I have severe pain during periods, or even they say that I have pain during intercourse or after intercourse. So then when ultrasound is done, we find they have endometriosis.
Okay.
So
Please continue.
So endometriosis is a condition where it is similar to the lining of the uterus, but it could be outside the uterus. So the commonest place could be the ovaries. So the ovaries kind of enlarge in size, and they could be anywhere between 3 centimeters to even
Right.
8 to 10 centimeters, which have a thick chocolate cyst, and where there is the ovulation is, hampered.
Impacted, yeah.
Absolutely.
So, pardon me, but even in a country like the UAE, where there's so much, the economy is so advanced, and most of the people are educated, they're literate, not just literate, they're highly educated, they're working. Why do you think the awareness about all these problems is so less, that they only come to know when they come for a regular, like a checkup for something else, and then they find out they have this?
No, well, there is awareness. Thanks to the UAE government, they have a lot of health campaigns, and even in the Latifa Hospital and other government hospitals, they do have general awareness, and we do have our talks where we give. But again, the PCO is very common in young girls and seen anywhere between 18 to 35 years of age. And if you see the incidence, it's more than 25.9%. So
Why is it so common? Like, is there a lifestyle issue?
Yes, lifestyle issue also, and even the diet and the exercise. Of course, even because of the weather. I mean, the children don't tend to go outside and play,
which is also another problem.
which is also, and also the diet plays a lot of role, because we do get patients who try and tell us, what do I need to do? So then we need to counsel them and educate them about the diet and how important it is to change your lifestyle and also to have a disciplined lifestyle.
But do you see women, because you see so many women every day, do you see them taking care of themselves over their families, or at least as much as they're taking care of the family? No?
Yes, they do. I mean, they do with this kind of our work, and everybody is in the rat race of work, everything career driven. Most of the women are all career driven, and now if you see, many of them are so career driven that you tend to push your family
family planning थोड़ा लेट कर देते हैं, या फिर
very true,
शादी लेट कर देते हैं.
True, all this gets compromised, but then they do take care and they do once get investigated. But again, it is like the main question is, doctor, is there a complete cure for polycystic ovaries? There's no complete cure for polycystic.
It's only treatable.
Yes, and we always try to tell the patient that don't have self-pity or don't do why me. Okay, it has happened.
ये बहुत common है.
Yes, it has happened. Okay, deal with it. I mean, what I mean to say is deal with it as in,
medically. Yeah, deal with it
medically, and do whatever things needs to be done.
What needs to be done, yeah.
But it is a challenge to make the young girls understand,
right.
like 15 years, 16 years, who are obese and BMI is more than 28 and 30. Yes, this is an age where they need to eat, but then again, with a good counseling of an endocrinologist, gynecologist, and a dietitian together, this issue can be tackled.
But if they just come to you, isn't it enough? Because see, I'll tell you what, practically a lot of doctors come and say all these things.
Yes.
But when you lead a life practically, it's impossible for people to go to multiple doctors. So why not just one doctor and get these problems solved?
See, from the gynecological point of view, I will do it. Yes, but then again, if I have to work out a diet for her, it has to be with a dietitian. It has to be a group practice. It cannot just be that I'm going to deal with everything. So the dietitian will work according to their body constitution, their fat and their protein and the carbohydrate,
and get them the right advice.
We need to give them a good channelize and give them a proper treatment so that they can be treated.
Finally, two questions. One is PCOS है, PCOD है, या fibroids है, या endometriosis है. ये सारे जो complications है, they are pretty much similar in their nature and the way they impact the patient. तो इनके कोई long-term effects है, like do they turn into cancer?
Well, PCO doesn't, but yes, PCO in case if their BMI is very high and they have a lot of, PCO happens because of there's a carbohydrate intolerance and the insulin resistance. So these patients can be pre-diabetic, and if their sugar levels are not controlled, then they can be diabetic and they'll have issues later
then of course
for conceiving. The other thing, what about the fibroids? The fibroids also, if it is not diagnosed at the right time and you see that there is a rampantly growing fibroid, and if you do not investigate it properly with MRI and other radiological investigations, we have seen the other malignant version of it, the sarcoma of the uterus, can also be there. So it is always better to act at the right time, and then
every year once a year you have to do your
absolutely
test.
Yes, and if people who have been diagnosed with endometriosis or fibroids, always better to get booked with a gynecologist and have an ultrasound every 3 months or 6 months to follow up and see the size. As I said, if they are in the reproductive age group, because the estrogen level is high, it can trigger the increase in the growth.
Right. And finally, do you see the trend of couples when they get married, testing each other, for whether they're medically fit or not, or ye abhi bhi nahi ho raha hai.
No. It is. See, we don't tell. Yes, we do get patients.
Do you advise the women you see, young women?
Yeah, like if they are newly married, and there are some women or a couple who are newly married, and within 6 months they come and say, oh, we are trying, but I'm not able to conceive. So we try and educate them and say that we do not investigate a couple who are staying together, and not for at least for a year. Only for a year, if you are not unable to conceive, then yes,
you come and see. Yeah.
And many of them will not have the right knowledge about what exactly when it is to be done. So then we try and educate them about the fertile period and the ovulation time and all. And yes, the men are, so many times we do tell them that the wife we have investigated, she is fine, so we'll have to get your semen analysis done, and they are quite open to it.
Okay.
Yes,
but
yes.
Are they also aware of the problems that the women in their life are facing?
Absolutely, they are, and they are very empathetic. Are very empathetic.
Thank you so much, doctor.
Thank you so much, Ronak. You have a lovely day. Thanks.
You too.
Bye-bye.
This is Talk 100.3.
1 minute down, next minute up.
It's the hottest summer for sport, and that means you need to cool down with some super cool, refreshing hops. The Barasti